In hereditary channelopathies, which are causes of sudden cardiac death, there is sudden arrhythmic death syndrome, and it's really sudden. It is characterized by a sudden cardiac death occurring out of hospital in a young adult, mostly men, during sleep or at rest. There is absolutely no premonitory symptom including syncope. कुछ नहीं होता, अचानक से पेशेंट सोता सोता मर जाता है. That to a young adult man. I'm not talking about old people here. And when you postmortem it, there is no anatomical abnormality. Second is ion channel disease. Cardiovascular and genetic examination of first degree relatives can identify an inherited form of heart disease, which is channelopathy or ion channel disease. Next is Brugada syndrome. Brugada most commonly affects men. There is a predominant J wave with down sloping ST segment elevation in lead V123. So a prominent J wave with a down sloping ST elevation and T inversion in leads V1, V2, V3. Brugada is common in Southeast Asia. It is also called sudden unexplained nocturnal death syndrome, and it needs to be identified. ICD needs to be placed. Next is early repolarization syndrome. So repolarization is what? It's basically the T wave represents ventricular repolarization. So as you can see in lead V4, V5, V6, there is a prominent notch and J point elevation with early T wave. This thing notch like J, and there is a T wave. So normal QT interval it's different in male and female, but it's mostly 350 to 450 milliseconds. In early repolarization, the QT interval may be normal or shortened. Then there is a long QT. So how do we calculate the corrected QT? It is QT corrected is measured QT divided by under root of RR interval. Na, corrected is measured divided by root of RR interval. Long QT is characterized by prolongation of the corrected QT, syncope and sudden cardiac death caused by torsades and VF. So what are the drugs that cause prolonged QT interval? We will remember them with the mnemonic torsades itself. T से thiazide, O से ondansetron, opioids, and R से risperidone, S से sotalol. बेसिकली आपके जो क्लास 1A और क्लास 3 ड्रग्स हैं, क्लास 1A में आती है ना, क्वीन प्रोक्लेस डिसोपेरामाइड, प्रोकेनामाइड, डिसोपेरामाइड, एंड आपकी एड्स ड्रग अम्योडेरोन, इबुटालाइड, सोटालॉल, ड्रोफेटिलाइड, ये सारे टोर्साडिस करेंगे, क्यूटी प्रोलॉन्ग करेंगे. तो थायजाइड, ऑनडैम, रिस्पेरिडोन, सोटालोल, एंटीहिस्टामिनिक्स, एंटी डिप्रेसेंट्स लाइक TCA, एरिथ्रोमाइसिन, SSRI, और आपकी क्विनिडीन और कुटियापिन, जिप्रासिडोन, ये सब भी क्यूटी इंटरवल प्रोलॉन्ग करेंगे. डिसइलेक्ट्रोलाइटीमिया से भी क्यूटी प्रोलॉन्ग होता है, लाइक हाइपोकलीमिया, हाइपोमैग्नीसीमिया, हाइपोकैल्सीमिया. सो कैल्शियम और क्यूटी का एकदम उल्टा चलता है. अगर कैल्शियम बढ़ेगा तो क्यूटी घटेगा. एनोरेक्सिया, इस्कीमिया, CNS, all of that. Then there is a short QT syndrome. In short QT syndrome, as I told, 350 to 450 millisecond is normal, so it's less than 350, about 340 millisecond the QT interval is, and it is caused by hypercalcemia, hyperkalemia, acidosis, free radicals, and hypoxia, or increased vagal tone. It can be inherited also as an autosomal dominant. Short QT, autosomal dominant. नाम में short है लेकिन है dominant. Then there is catecholaminergic polymorphic VT. There is exercise and stress related VT, syncope and sudden cardiac death. तो सुना ना कि जिम में बंदे को VT हुआ, मर गया वो. So individuals have sinus bradycardia that is not otherwise explainable. And beta blockers are the mainstay of prophylaxis against catecholaminergic polymorphic VT. So HOCM में और इसमें पता कैसे लगे? These patients have a normal ECG and no characteristic abnormalities on examination. Many times they are thought to have seizures because these things, syncopes, occur in the late childhood or early adulthood. तो ऐसा लगता है कि बंदे को मेरी आती है बार बार. Common causes of brady-systolic arrest are the common causes of bradycardia, myocardial infarction, especially RVMI, sick sinus, again RA, asphyxia including near drowning, hypoxia, hypercarbia, stroke, and drugs which suppress sympathetic activity and respiration like opioids, beta blockers, calcium channel blockers, adenosine, and parasympathetics. As you see, apart from opiates which suppresses your respiration thus causing hypoxia, all the other drugs are AV nodal blockers thus causing brady-systole. And what are the conditions that cause pulseless electrical activity? 5H and 5T, or 6H and 6T if you want to remember. There are various categories of shock. The most common is distributive shock. There is decreased preload, decreased resistance. Main thing is distributive, there is decreased systemic vascular resistance. Sepsis, neurogenic shock, and anaphylaxis. Hypovolemic, you know why it happens. There is decreased preload and decreased cardiac output. Cardiogenic, again due to decreased cardiac output. Obstructive is rare. It is also primarily due to decreased cardiac output. Causes, you know, distributive is sepsis, anaphylaxis, neurogenic. Hypovolemic is hemorrhage, capillary leak in dengue, GI loss, burns, anything that is causing fluid or blood loss or extravasation into the extracellular fluid.